Hi, this is e-patient Dave DeBronkart coming to you from New Hampshire in the United States, about an hour north of Boston. I'm grateful for the invitation to speak with you today. I am a cancer survivor who has gone on to become an advocate for listening to patients in a new way. And I'm going to take a few minutes to explain to you how this idea of e-patients is what's changing what's possible in the conduct of healthcare. It's become a little bit widespread in the United States. It's beginning to take hold in Europe. It's in Australia. And it will be covering the entire world because history is moving in the direction of more power in the hands of the citizen. 9 years ago, I was diagnosed as almost dead with stage 4 renal cell carcinoma. This is a diagram of where the tumors were. There's a metastasis in my left femur. I had one in the skull. I even had one growing out of my tongue. And in fact, the best available statistics said that my median survival at diagnosis was 24 weeks. It's a long story how I ended up surviving. I got an immune system treatment even back then, and 50 weeks later, here's how one of my tumors had shrunk without being cut open. There's a lot more information about that story on my website, epatientdave.com. Two of the senior physicians at my hospital in Boston are Warner Slack and Charlie Safran. Dr. Slack has been saying since the 1970s that patients are the most neglected healthcare resource in the world. And I'm a patient, but I have no medical training. So the interesting question is, what is he talking about? I've met Dr. Slack. He says this continues to be absolutely true. That's what I'll be covering in these few minutes. I'm a follower of Dr. Tom Ferguson, who died 10 years ago this month. He was a real visionary. He saw how access to information would change what patients are capable of. It would not make us oncologists or general practice physicians, but it would give us access to information and access to other people like us. In my case, the patients who I met on the internet, according to my oncologist, information they had that was valid and not in the literature helped save my life. But that's only part of what we're talking about. Ferguson made up this word e-patients: equipped, engaged, empowered, enabled. Notice you can be an e-patient on the internet, but you can also be engaged, empowered, and enabled without being on the internet. So this is a social change first, which is enabled by the internet. This is my doctor and me looking at my medical record together. This could be a piece of paper as well as it could be a computer. The friends of Tom Ferguson on that previous slide formed a society for participatory medicine in 2009. The symbol is a handshake. I want to spend a few minutes thinking about what is it that a person with no medical training could bring to the conduct of an individual case. And this is an important question because, it does no good to say, I want to speak up if there's nothing that I can contribute. Well, consider this. In the United States, the Wall Street Journal last year had an article on the front page of the healthcare section saying that 85% of medical records contain some kind of mistake. And it turns out I gave a speech a few years ago to an audience of medical record technical people, and I asked them, have you ever looked in your own medical record to find out if the information is accurate? The great majority of people, the big blue bar, said they had never looked. A small number said they had looked, but they didn't know. The red bar, 7 of the 16 who looked, said they looked and found errors. That's almost half of the people who looked. And 4 people had looked and found no errors. So the probability of there being mistakes in the medical record is very high. The question is that going to make any difference? Well, I say yes. And in fact, the other doctor I mentioned from my hospital, Dr. Charlie Safran, told me recently that he's now changed it. It's no longer the patient, it's the patient and family who are the underused resource, because they may know something about the patient that is not in the record anywhere. Now, the problem is, if a doctor has been taught that patients know nothing and you should not trust their word, you should disregard them, then something bad can happen if they're right. Here's an example. This is my mother when I was a baby. And if anybody tries to hurt my mother, it's not a good thing. Well, here she is a few years ago with one of my sisters. She had surgery to replace her hip. The surgery was successful. But when she was transferred to a rehab place to be taken care of after the surgery, somehow the medical record said that her thyroid was high when it's actually low. And the point here is no clinician can do what they're trained to do if the information is wrong. The best doctor in the world could have killed my mother because of the mistake in the medical record. Now, what actually happened here is that my sister was there, both of my sisters, and said, could we look at the record? And they did, and it was all on paper, and they said, and they found the mistake and got it fixed with no harm done. So there you have the patient and family, the underused resource, preventing a disaster in medicine. So now, and you've got to wonder, who has the most at stake with the information being accurate? It's the family. Now, this is no insult to physicians. It's just that patients and families can bring more to the table, can contribute more to the case than they used to be. I want to make clear also, this is not just the patient movement running down the road with pitchforks and torches and complaining. The Institute of Medicine, which is the top of academic medicine in America, published a big report in 2012, that's 4 years ago, saying that one of the 4 cornerstones of the future of medicine is patient-clinician partnerships. And they specifically said engaged, empowered patients. So now it's not just a social movement against the establishment. The establishment is saying, yes, this is correct. Now let's take a minute and ask, what do we mean by these words, empowered and engaged? Well, empowerment has a really good definition, and it's fascinating to me where this definition comes from, because empowerment has been traveling around the world for the last 100 years. Citizen empowerment. This definition says empowerment is increasing the capacity of individuals or groups to make choices and to transform those choices into actions and outcomes. Well, it turns out this is the definition that's used by the World Bank when they go into a developing nation. And the same applies in healthcare. So you can see anything you do that increases the capacity of the group or the individual to make choices or take action, that's empowering. And anything you do to take away that capacity, like not listening to them, that would be disempowering, and it can cause things to fall short of potential. What do we mean by engaged? Well, the simplest answer is that if you can tell if somebody is engaged in conversation with you, they're listening, they're thinking, they're responding. There's a good body of literature about patient engagement. One of the best books is by Angela Coulter. It's called Engaging Patients in Healthcare. She published a review of review articles in 2012 called Patient Engagement, What Works? It's a review of the evidence. It was in the Journal of Ambulatory Care Management. And she says, various interventions designed to help patients play an effective role have been evaluated in trials and systematic reviews. One of the best measures of patient engagement is the patient activation measure. It's a simple interview that grades people into 4 levels of how activated they are as a patient. And I'll just quickly show some slides. You can look at the literature for the patient activation measure. Level 4, the most activated level of patients, is shown as yellow here. And in each case, you can see on all these are behaviors among diabetes patients. People just do better at all of the behaviors that a diabetes patient needs to do if they are more activated. Behaviors in the medical encountered. Did somebody read about complications? Do they bring the doctor a list of questions? And so on. And this is the sign of an immature science. There are many patient engagement frameworks. When a clinical discipline is immature, there are many conflicting frameworks about how you should approach it, and no science can move forward until that's solved. That's the stage that we're in right now. So we have the PAM, as it's called, one of many engagement frameworks. The Center for Advancing Health, CFAH, has another engagement behavior framework, which has some overlap, but it's different. There's also in our Health IT Professional Society, which is called HIMSS, HIMSS, they have a patient engagement framework, and there are at least a half dozen other ways to look at the issue. And the thought that I want to leave you with on this, there's a fabulous book from 1962 called The Structure of Scientific Revolutions that describes the process any scientific field goes through when it turns from being disorganized and then turns to having a paradigm, an agreed model for how the field works. Then eventually you reach a stage where there are experimental results that cannot be explained by the paradigm, and a scientific revolution happens. The most familiar, of course, is the Copernican revolution. We used to think the Earth was the center of the solar system. Now we know it's not. The state of patient engagement today is that it is a puzzle with no agreed paradigm. So the science of patient engagement is moving forward. But the other aspect is people will look at you sometimes when you talk about patients as contributing value in medicine, and they'll say, that's ridiculous. Well, this is just culture change. Those people are often ignoring the evidence. Culture change is hard, but it's possible and it's inevitable. My favorite example of this is from 100 years ago when women were starting to demand the vote. And this is a campaign brochure from 1912 in the United States. It said to vote no on women's suffrage. And the number one reason it's funny. It says 90% of women don't want it or don't care. And this exactly matches what we hear today with patients, where some doctors will say, my patients aren't asking for this. Well, you know, and in any cultural evolution or revolution, there is a beginning stage where only some people are asking, but it's obvious how it always turns out. So the question for the forward-thinking medical professional is what can we learn about what is possible with patient engagement? And how do we then turn that into practices that we know will work? Researchers around the world are studying patient engagement and empowerment now, and I encourage you to keep up with it. Again, this is no insult to physicians. It's part of the march of history toward liberation and power. E-patients are changing what's possible in healthcare, so thank you for your attention, and I wish you a great conference.